Hello everyone, welcome to the Tooth Head Academy. Today I will be taking up the dental caries. It's an important topic. Its theories and classification. So what were the earlier concepts and what are the new concepts which has came? So I will be discussing one by one everything. So without wasting time, let's start with the dental caries. So this is the definition of the dental caries given in the student. What does it mean? Dental caries is an infectious microbial disease of the teeth that the microorganisms are responsible for causing this disease, that is dental caries, that result in localized dissolution and destruction of the calcified tissue. So this result in the destruction of the calcified tissue, that is enamel and dentine. So this is the definition. There are various definition which is given. This is the one which is written in the student. So coming on to the etiology, what are the various theories for dental caries? Let's start with the earlier theories. Even nowadays you have seen quack which shows people, look, we have took out worm from your tooth. So that was the concept of the earlier theory, the legend of the worm. According to this, the dental caries is caused by worms. But nowadays we know that worms are not responsible. It is the microorganisms. Then the endogenous theory, in which first is the humoral theory. And according to this theory, any disease in the body occur because of the imbalance of your four humors of the body, and that is even responsible for dental caries. But this concept, we know this is not the reason for caries. Then came the vital theory. According to this concept, that caries occur within the tooth as the gangrene. So similar to that process, caries occur within the tooth itself. So it is also not being followed. Then came the chemical theory. According to this, the acid is responsible for the caries. And how the acid is formed? That is formed by the fermentation of the food around the teeth. And they said that nitric acid and sulfuric acid, these are responsible for caries. But nowadays we know that lactic acid is responsible, not the nitric acid and the sulfuric acid. Then came the next theory, that is the parasitic theory. According to this, the parasites are responsible for caries. Again, it is not being followed. Then came the exogenous theory. The most accepted theory is the Miller's chemoparasitic theory, that is the acidogenic theory. According to this, the microorganisms acts on the food which is remains around the teeth and form an acid. Acid causes the decalcification of enamel and followed by dissolution of the softened residue. Once it attacks the enamel, then it is followed by the dentine. So this is how the caries have occurred. So this is the most accepted theory. Then came the proteolytic theory. According to this theory, proteolytic enzymes are responsible, that according to this theory, organic matrix of enamel is first attacked, then followed by the inorganic. But as we know, there are limitations. As we know that the main content or the enamel is mainly made up of the inorganic content, and organic content is less. How is it possible that the microorganisms or acid act on the organic content rather than the inorganic? And there, second is that there is the absence of proteolytic enzymes. According to proteolytic theory, the proteolytic microorganisms were responsible for caries. So there are absence of proteolytic microorganisms and they are not able to simulate caries with proteolytic agents. Then the sulfatase gram negative bacilli have not found in abundance in experimental studies, so that's why the limitation and it's not being followed. Then came the proteolytic chelation theory. According to this theory, first the organic component is attacked, then followed by a dissolution of inorganic by a process called chelation. That when the organic component is being attacked, the chelates are formed, which attaches or the inorganic compound chelates with that, and that lead to the process of caries. Again, the problem is that the inorganic content of enamel is more as compared to the organic content, so that's why it's not being followed. Then came the Levine theory, ionic seesaw theory. That is the main that is an important concept. Under this also came the critical pH. So it shows three important factors: pH of the plug, calcium and phosphate concentration, and then the fluoride concentration. So there is a, when we eat a food, then the pH falls. If the pH falls below 5, what will happen? There will occur demineralization of the tooth. There will be the loss of calcium and phosphorus ion into the saliva. And after 20 minutes, saliva will buffer the pH of the pH of the plug will increase. pH will increase. Once the pH will increase, it will cause, if there is sufficient calcium and phosphate ions which has not removed from the oral cavity, if there are sufficient calcium and phosphate ions are present, they will get deposited onto the tooth surface. That will be remineralization. So if the pH critical pH is 5, if the pH is keep on falling below 5, that will lead to demineralization. That will lead to keep on leading to demineralization, and that will lead to caries formation. So this is an seesaw concept, that it depends on the pH. If the pH increases, there will be deposition of calcium and phosphate ions. If the pH decreases, there will be the loss of calcium and phosphate ions from the tooth surface. And an important concept is fluoride also. If there is sufficient fluoride concentration is there, then even at pH below 5 even if the concentration is low as 5 ppm, there will be chances of the deposition of calcium on the enamel is more. So fluoride ions favor the remineralization process. So here you can see, from saliva it goes to the tooth, from the tooth it goes to the plug. So it's a ionic seesaw concept. Then these were the concepts. Now we coming on to the classification of caries one by one according to the morphology. First is the pit and fissure caries, which occur in the pit and fissure area. Smooth surface caries, that occurs in the smooth surface area. Root caries, that occurs onto the root surface. Then come to the according to severity and progression. Incipient caries, that is the initial caries. What happened? This caries, there is no cavitation is there, and it has the potential to remineralize. So that is the incipient caries. How we that gives a chalky white appearance when we dry it. If we dry the tooth, it gives a appearance as you can see in this figure. But once it become moist, when the tooth get moist, it disappear. Okay, it's non-cavitated. It has the potential to remineralize. Then second is the rampant caries. Rampant caries is an aggressive caries. According to this, if a caries 10 or more new carious lesions appears in a year, that the patient has rampant caries. So it is a more sudden and rapid onset, and it at least involves 2 teeth and 2 surfaces. So this is the rampant caries. Then is the arrested caries. Once the oral conditions get favorable, the caries process get stopped. So that appears as you can see dark black surface, dark black lesions. So that is the arrested caries. Then is the recurrent caries. Once we have restored the tooth, but again caries has occurred at the margin of the tooth, and the restoration, that is the recurrent caries. Then is the radiation caries. Radiation caries occurs in the patient with which have gone radiotherapy for oral cancers, which lead to xerostomia. So that causes radiation caries. Then according to the age, first is the nursing bottle caries, that occurs in the kids or the child which take bottle. Then the adolescent caries, which occur at adolescent age. Geriatric caries, which occurs at the late age. Then according to spread of caries, rate of spread, acute, that it spread fast. Then is the chronic, that has slow going nature, that the caries spread slowly, that is the chronic caries. Then is the according to the pathways of dental caries, that is the forward caries and backward caries. Forward caries means caries occur from enamel to dentine, that is the forward, that is the main path. Then is the backward caries. Backward caries means caries occur from enamel to dentine, then it spread laterally at the DEJ, and then again from the lateral spread it spread into the enamel. So what happened? Try to understand backward caries. From enamel to dentine, caries has spread. Then it has spread at DEJ, lateral spread, that it has spread more into the dentine as compared to the enamel. Then from the lateral spread at DEJ, again the caries has progressed from dentine to enamel. That is the backward caries. According to the surface involved, simple carious lesion, only one surface involved. Compound, two surfaces are involved. Complex, more than two surfaces are involved. That is the complex carious lesion. Then this is the most important concept for the caries. That is the GV Black caries classification. First is the class 1. As you can see in the figure, class 1, it is the Pitt and Fisher caries. All Pitt and Fisher caries are class 1 caries. So in this, it is further divided into 3. First, onto the occlusal surface of the posterior teeth, that is molars and premolars. Then occlusal 2/3 of the buccal and lingual surfaces of molars. As you can see, the fissure extend from occlusal surface to the buccal and lingual only into the molars. So if the caries occur in that area, that is the class 1 caries. Then into the lingual surface of the maxillary anteriors, that is, the fissures are there into the lingual surface or the palatal aspect of the maxillary incisors, that forms the class 1 caries. Then is the class 2 lesions, that occurs in the proximal surface of the posterior teeth, that is molars and premolars. Class 3 cavity or carious lesion, that occurs onto the proximal surface of the anterior teeth without involving incisor ledge. Class 4 anterior teeth involving incisor ledge. Then is the class 5. Class 5 onto the gingival third of the even on the buccal and lingual aspect of all the teeth, either posterior or anterior, that is class 5. Then the Simon added the class 6, that is class 6 onto the occlusal cuspal height of the teeth or the incisal edge of the anterior teeth. So this is important. GV classification is very important. Thank you so much. I hope I have tried to make you understand easier. Thank you so much.